very excited about having Susan Inman come tonight to talk to our families here in Richmond Hill. We're excited because she's going to share information about mental illness, and she's going to talk about particularly cognitive losses in people with serious mental illness. And we feel that people are doing a really good job about talking about stigma, but we need to move on and talk about the illnesses themselves so that it's the knowledge that will finally defeat stigma.
The important thing is to understand that people that have very serious mental illness have dignity and have a right to a good life, that they are not to be feared. In fact, they are the ones that are fearful. They are also entitled to adequate housing, which is something that is just non-existent. All of that is a major obstacle, and it will take a lot of talking, a lot of proactive lobbying to come to the point where people will at least want to listen.
We know everybody wants to be loved. We know everybody wants to have a place to live. Everybody needs meaningful employment and work. And where does that happen for people with serious mental illnesses? Not one family in the country is saved from this serious mental illness. 1 in 4 to 5 families have somebody with a serious mental illness. And where do they turn? Oftentimes the help is very late, and we're always reactive rather than proactive in terms of we wait till things are at crisis level in our home or crisis level in our community before there is action.
I think most young people want to be able to get out on their own, not always be at their parents' home, and for their parents, in many cases, they are their sole caregiver, so they're anxious about them being out on their own. They're looking for somewhere where they can feel that they're safe, they can be interactive with them, and yet, the young people can feel, and actually have some older middle-aged people can feel that they're somewhat self-sufficient, they're on their own, it's their place, and they can have a good life, and it has a community aspect to it, family involvement, and just a good place to be.
Thank you for your continued commitment and support to understanding mental health and illness, and to our organization, which, as you know, continues to affirm both the dignity and respect of all residents of Richmond Hill, especially those who are dealing with serious mental illness. Our hope at Home of the Hill is to provide residents with serious mental illness a place of refuge and supportive housing.
We, as citizens of Canada, Ontario, Toronto, York Region, Richmond Hill, we need to increase our knowledge about this very issue. And I'm so grateful, Susan, for you coming over to talk about this issue, educating us. But I think each of us we have to go and talk to our families, to our friends, to our relatives in our workplace about this issue, because impacting us wherever we go.
She's one amazing advocate for the mentally ill, and especially for families coping with serious mental illness. In 2013, she was recognized by the Queen Elizabeth II Diamond Jubilee Medal, which goes to people who provided an opportunity to honor exceptional Canadians for their contributions to their fellow citizens, to their communities, and to their country. And that's Susan. That's exactly what she's done. So I'm very pleased and honored to invite you now to deliver your talk, What Families Need from the Mental Health System.
It's really a great privilege for me to be here with you all tonight as the family caregiver of somebody living with a very significant mental illness. And I will talk about my daughter's situation later, just a preview. She's lovely. She has amazing acceptance of her illness because she had high quality psychoeducation, she and her friends, which has led to years of stability, because she had access to involuntary treatment when she needed it and never wants to be left in the future in untreated psychosis, and because she's had a very collaborative psychiatrist. However, My daughter, like many people with schizophrenia and some other psychotic disorders, is profoundly disabled because of predictable cognitive losses. And I'm going to be talking about these with you more. So what do we need from the mental health system? We need state-of-the-art, evidence-based psychiatric and psychosocial rehabilitation services. We need collaborative relationships between mental health professionals and families who really do provide the bulk of care for people with the most severe mental illnesses. We have inadequate public education about severe mental illnesses. You might have known or might not have known that in May, in fact, there was Mental Illness Awareness Week. And this has been going on for quite some time. It's organized by the Canadian Alliance on Mental Illness and Mental Health. And I am waiting to hear anything that could educate the public about the illnesses that we are dealing with. We also need to pay attention to the inadequate education of many mental health professionals. I hope people in this room realize that there are programs across the country, including graduate programs like the University of British Columbia's Masters in Counseling Psychology, that regularly train people who become credentialed mental health clinicians. And these programs neither offer nor require any science-based information on psychotic disorders. People do real damage when they don't have the knowledge that they need. Real damage was done to my daughter because we do know that the duration of untreated psychosis, and that's what inappropriate treatment leads to, this duration of untreated psychosis leads to worse outcomes. It's bad for the brain. We need to get people out of psychosis quickly, and to do that, we need an adequately educated mental health force. We need people to be getting really good advice, and people are not getting that good advice. These are two crucial things people with these illnesses need to learn about. They need to learn about anosognosia, which is the brain-based inability of people in profound psychosis to understand that they are ill. This is different than any psychological denial mechanism. It means that when somebody is really psychotic and really ill, telling everyone that the human rights position means that we must always listen to the person is not the moral high ground, it's the moral swamp, because it destines people to be lost in untreated psychosis. The second thing that a really good psychoeducation program acknowledges and teaches its participants about are these predictable cognitive losses. They have to do with difficulties with working memory, short-term memory, sequencing, which are the steps that we go through to plan an action. These can be absolutely disrupted by these illnesses. Reasoning, judgment, problem solving, social skills, these are well-researched cognitive losses. If I had let my daughter in the depths of psychosis make decisions, I don't think she would be alive anymore. We need to support families to make these difficult choices about involuntary treatment, and we need to help people who have become stabilized not to have more blame for their families, that their families persevered, but that they should be grateful their families may have persevered against great odds to get them the treatment that got them out of this hell, which is really what psychosis is, being cut off from reality. Moving on with what we have instead of what we want, we have inadequate emergency services, and I know from talking to many people this is a problem. I did want to tell you about something that we do have in Vancouver, and because we have an annual family conference, which we also want to talk about a little bit later, more people from outside Vancouver have come to learn about Vancouver's CAR 87 and CAR 88. And this means that when there is a crisis in someone's home, you can call mental health emergency services, and you can get both a police officer and a psychiatric nurse to come to your home. And even when the system isn't totally overloaded, you can ask that the police officer comes in a uniform, if we think that's going to be more helpful, or comes in casual street clothes, if that's going to be more helpful, when they come to your house. And they will evaluate your family member. If your family member needs to go to the emergency room, as opposed to you going through all the difficulties of getting them there and waiting with a very psychotic person in an emergency room, they do this. We have an inadequate number of acute and longer-term psychiatric beds. It's really important that before people with profoundly psychotic illnesses are discharged, they need to have their illness basically stabilized. And that often does not happen in a few days. But we have to persuade the people in charge of the purse strings that they will save money in the long run if they make sure that people spend the amount of time they need getting treated and getting stabilized before we send them out into the street. We have inadequate supported housing, except you all have hope and a vision for the future because you have Home on the Hill, which is just an amazing model. Family-friendly supported housing. I'm trying to learn all I can about it to tell people in British Columbia. We have some psychosocial rehabilitation programs that are really inappropriate. As a taxpayer, I don't think it's okay that our publicly funded healthcare system provides any psychosocial rehabilitation services that can make it more likely that somebody with a severe mental illness becomes more likely to drop out of treatment, medically based treatment that they need. So what can we do? Well, we can call attention, identify and call attention to what is needed. And I think those of us who have ill family members and are dealing with the mental health system can see this all the time. We are the only ones that can say, I want my family member to receive services that will not undermine the belief they have in the medical treatment they are receiving. This is reasonable for us to ask for. We owe this to our family members. And we need to identify how we can work to get what is needed. We need promotion of these evidence-based cognitive adaptation and cognitive remediation programs. Just to explain, cognitive adaptation, and you'll find a lot of really useful things about that in the BC Psychosis Toolkit, are things that you're not so much focusing on changing somebody's brain as just making life easier, because it's hard with these cognitive losses. Things like checklists, alarms, signs, increasingly technological aids, so that there are things that you can do to adapt the environment that can help somebody manage it better. Cognitive remediation really works on helping restore, in this era of neuroplasticity, certain kinds of brain functioning that have been lost. So how can we work to get what's needed? You can volunteer with the local mental health system when there's an opportunity for family representation. The Mental Health Commission of Canada did a very useful document about guidelines for increasing family involvement. Kathy McNaughey, I think she refers to it every time she writes any letters, any document I see really important. She wants people to know the Mental Health Commission of Canada says families should be involved in the planning of services and evaluation of services. Let me know if it happens here. We're pretty early on in Vancouver Coastal Health, although there is some progress. And cognitive remediation won't happen without families. You can get to know your local government officials, which you guys are really good at, and it's pretty wonderful the way people have come here tonight. It's spectacular. You can comment online from the family caregiver perspective. I think Marvin and I can both tell you from, well, he's not as wounded as I've been, that when you write articles from the perspective we have, you will be attacked. And we always want more families to keep sending the messages that need to be sent out. You can write op-eds. You can build relationships with journalists, so we have more Kim Zarzurs in our communities. And you can do what you're doing, which is to build our own educated, supportive communities. And to me, the work of Home on the Hill is a model for the future. So thank you very much.